So yesterday at work I was filling a prescription for Pimobendan. It's a hard medication, serious stuff. Then I noticed patient's name, Bella, who is a dog with cognitive heart failure. And I am standing there in my regular pharmacy, not a pet store, not a specialty vet pharmacy, just a normal apotheke downtown in Sweden, filling a prescription for a dog with heart failure. Same quality standards as human medications, same national database, same pharmacy counter. In Sweden, your pet's prescriptions come through the exact same system as yours. Same pharmacies, same electronic prescription database, same regulations. I dispense medications for dogs, cats, rabbits, horses, even guinea pigs, all at the regular pharmacy counter. And this creates one of the most accessible pet medication systems in the world. Let me tell you about this woman who came in last month. She looked nervous, holding her phone with trembling hands. She walks up and says, "My cat just had a surgery. They said the prescription is in the system. I've never done this before." Her cat, Texas, apparently had some dental work done, needed pain medication and an appetite stimulant. I pull up her cat's profile and there it is, right between prescriptions for humans. Patient's name, Texas. The vet had prescribed meloxicam for pain and mirtazapine to stimulate appetite post-surgery. I dispense it. Same quality checks as with human medications, same documentation, same insurance receipt process. She paid about 100 kroner out of her pocket. Her pet insurance would reimburse 400 to 450 kroner later. She left with medications that met the same pharmaceutical standards as if I dispensed them for a human patient. This happens here dozens of times per day. It's completely normal. So what exactly I am dispensing for pets? Let me walk you through the most common medications. First up, antibiotics. Dogs, cats, rabbits, they all get bacterial infections just like us. Doxycycline for respiratory issues, amoxicillin for that infected paw, cephaloxin for skin infections. These are my most common prescriptions at the pharmacy. Painkillers and anti-inflammatories. And here's what's cool. Meloxicam works across all these species. Same medication for a dog, a cat, and a horse. Swedes love their horses, by the way, so I dispense a lot of equine medications. Carprofen and gabapentin are also big players here. Blood pressure and heart medications. This is mostly a dog thing. Pimobendan is the gold standard here. Remember Bella with cognitive heart failure from the intro? She was on Pimobendan. Enalapril and furosemide support the treatment. These keep older dogs going strong. Antiparasitic drugs for ticks, fleas, internal parasites. Floraliner, afoxoliner, milbemycin oxime. These active substances are essential in Sweden. When tick season hits and everyone's doing forest walks every weekend, my counter gets busy with these. And here's an interesting exotic one, mirtazapine. It's an appetite stimulant mainly for cats. Remember Texas who had a surgery? He got this to help him start eating again. Works like a magic for finicky post-op cats. One of those medications that make pet owners go, "Wait, you can't prescribe that for cats?" Now here's where Swedish pet owners get absolutely wild. In most countries, pet insurance is rare. In US, it's probably 2 to 3%, UK maybe 25%. Normal numbers. Sweden, 90%. 9 out of 10 Swedish dogs are insured. This completely changes the economics. That 500 kronor prescription I mentioned? With insurance, the owner often pays 50 to 100 kronor out of pocket. Insurance reimburses 400 to 450 kronor. So when a vet says your dog needs this medication, there is no sticker shock. Financial barrier is minimal. People don't skip treatments. We don't let things get worse to avoid the costs. Compare that with countries where pet insurance is rare. A $500 vet bill can make people think twice. But here, it's just normal healthcare for a dog. Now you might be thinking, are pet medications held to the same standards as human drugs? Yes, because of EU regulation. Veterinary medications follow identical pharmaceutical standards. Temperature control during transport. Batch tracking for recalls. Same expiration date monitoring. Identical quality testing protocols. Same manufacturing standards. Full documentation requirements. When I dispense meloxicam for a dog, it's held to the exact same pharmaceutical standards as if I were dispensing it for a human. Same storage, same tracking, same quality checks. Alright, so you are a tourist or a new arrival in Sweden. Your pet needs medication. What's the actual process? First, the vet. They examine your pet, write a prescription, and most of the time it goes to the National Electronic Prescription System. That prescription goes to the same database as human prescriptions. It's all integrated. Step 1. Vet examines your pet and writes a prescription. Step 2. It goes to the national database, usually electronic, but sometimes paper. Step 3. You come to any pharmacy, show ID if it's a controlled substance. Pick up your medication and keep a receipt for your insurance claim. Now here's the critical thing. Antibiotics. 5-day validity period. You must pick up within 5 days or the prescription expires. This is Sweden's strict antimicrobial stewardship, toughest in the world. If your antibiotic prescription expires, you need to contact your vet for a new one. They take this seriously here, but for everything else, pretty straightforward process. Look, I know this might sound like a pharmacist nerding out about Swedish bureaucracy, but here's why this matters. It's not about Sweden being quirky. This is about the human-animal bond becoming medicalized. According to the 2024 Zoetis Human-Animal Bond report, 46% of EU households have pets. That's nearly 1 in every 2 homes. When pet ownership is this widespread, it makes sense to build integrated healthcare systems like Sweden's, where pets use the same pharmacies as people. When you medicalize that relationship, when pets get the same pharmaceutical standards as humans, you create a system where pet healthcare isn't a luxury, it's just healthcare. Swedes figured this out 130 years ago when they invented pet insurance in 1890. And now, a dog with heart failure gets same quality medication, same tracing, same professional dispensing as human with heart failure, just at the veterinary dose. So yeah, next time you are in Sweden and you see someone at the pharmacy counter picking up medication for Fluffy or Rex, that's not weird here. It's just Tuesday. Your dog uses the same pharmacy as you. And honestly, that's kinda genius. If you're new to Sweden or planning to visit with a pet, save this video. The antibiotic 5-day rule alone will save you a headache. And if you know someone moving to Sweden with a pet, send them this. They'll thank you later. Thanks for watching. I'm your pharmacist at T Pharmacy. Hej då!